Welcome to another mentoring moment with Dr. Mo. I'm Dr. Mo, and in this mentoring moment, we will elevate and enhance your tapping practice by taking a deep dive into why the gentle techniques are called gentle. What is it that makes them gentle? So, clinical EFT is based on an exposure type paradigm. This is why it is said to incorporate some elements of exposure therapy into the modality itself. And so, as you can see from this graphic on the screen, the gentle techniques exist on the lowest end of that exposure spectrum or that exposure scale. So, the gentle techniques offer the lowest exposure to something intense, but also at the same time offer the highest separation from intensity of any kind. So, the way that I interpret gentle to mean is that gentle means purposeful and intentional dissociation or separation from something intense. And of course, this definition of gentle is only in relation to the gentle techniques specifically. Okay. So, the word dissociation gets thrown around a lot. So, let's talk a bit about what it is and some qualities about it. So, quite literally, the definition of dissociation means the action of disconnecting or separating or the state of or a state of being disconnected. So, in the realm of psychology, some qualities of dissociation include a disconnection between oneself and one's sensory experiences in the world, one's thoughts, disconnection from one's idea of self-identity, or an inability to access personal history, such as memories. Dissociation can manifest as being unable to feel anything, either emotionally, physically, or both. And it is often characterized as this general feeling of numbness or just feeling separated, distance from something, anything, or anyone. So this creates difficulty in relating to the world and relating to oneself. And when one has been subjected to a lot of trauma, dissociation is often a protective mechanism that the body and the mind employ to ensure that there is continued survival. So, dissociation can obviously be a hugely negative thing, especially when it is quite chronic and prolonged. And indeed, there are many psychiatric disorders and conditions that are based in this pathological experience of dissociation. But even though dissociation can have its dark side and it can be a negative thing, sometimes utilizing elements of dissociation for a brief amount of time within a session can actually create a much needed separation from intensity to ensure the safety of your client. So let's bring all of this together. Why are the gentle techniques deemed to be gentle? Well, gentle techniques ensure safety of the client by inducing brief states of dissociation or separation from anything that is particularly intense. And of course, these states of separation are induced by the practitioner, and they can be induced at varying levels depending on what the client needs at the time or how the client is presenting. So you may remember this exposure scale that was a couple slides back. And yes, you can see that the gentle techniques are the lowest in the exposure levels. But maybe you're wondering, among the gentle techniques, is there one specifically that offers maybe the most dissociation? Is there a ranking of the techniques according to how strongly dissociative they are? And that's actually a really great question, and I don't really have a straightforward answer to that, but you could say that of the 3 gentle techniques, sneaking up, chasing the pain, tearless trauma, sneaking up actually offers the most separation from something because it doesn't address something directly. It's working with the thought or the idea of even considering to work on something or considering to process something. But, even if that is true, even if sneaking up is the most dissociative and offers the most space, tearless trauma and chasing the pain are right on the heels of sneaking up. They're right up there, since they also offer considerable amounts of separation from intensity. So, as you as a practitioner experience using the gentle techniques in practice, you will notice how seamlessly they all seem to work together, and how ranking them in terms of their dissociative strength is kind of difficult because the strength of separation you want to induce may be relative to what your client needs at the time. For instance, so strong induction of dissociation for one client could mean chasing the pain, while for another client, it could mean using tearless trauma. I'm curious about what you think. So leave your comments below and we can get this topic into discussion, and that would be awesome. But until then, I hope you have enjoyed this mentoring moment with Dr. Mo. I'm Dr. Mo, and we will talk and tap soon. Bye-bye.